Bismillah ar-Rahman ar-Rahim. My name is Zahraa Muhammad al-Marhoumi, lecturer of restorative dentistry. Our subject today is laser in dentistry. The word laser is an abbreviation formed by joining the first letter of the words light amplification by stimulated emission of radiation. L refer to light, A refer to amplification, S refer to stimulated, E refer to emission, R refer to radiation. The principle of the laser was first known in 1970 when Albert Einstein described the theory of stimulated emission. It is the abbreviation of microwave amplification by the stimulated emission of radiation, which is first reported in 1958 by Scalwell and Towns using ammonia gas and microwave radiation. New laser technology slowed following in 1960. The X-ray lasing action was developed in 1980. Finally, plasma lasing was created in 1993. However, despite the lull in creating new lasers, the efficacy and the effectiveness of the lasing has improved drastically since its conception. Also, many new uses have been found for the laser during the last few decades. Laser light is produced by a chain reaction of atoms. Every laser has a laser medium such as ruby, argon, carbon dioxide, or a variety of other elements, and each laser has a source of energy to excite the atoms within this medium. The medium and the energy source is contained within a laser tube resonant cavity. When the medium is excited or charged with energy, the atoms are brought into an excited state above their ground state. As the energized atoms interact with each other and return to the ground state, the photons of identical wavelengths are emitted. When the photons interact with other atoms in excited state, they stimulate the emission of more photons and the light intensity is rapidly amplified. The photon leaves through the partially silvered mirror at one end, which produces the laser light. Characteristic of the laser light: monochromatic, which means that the laser light has the same wavelength of the light, one specific color. Collimated, a laser light has a very tight beam and is very strong and concentrated and focused. Coherent or organized, in each photon moves in step with others. This means that all the photons have identical wavelengths and frequency. This image explains the characteristic of the laser light, which is very condensed, not diverging, parallel to each other, have the same wavelengths. These characteristics are very different from the light from a light bulb. Light bulb has many color mixed, doesn't come in a narrow beam, can't be focused to as small a spot, can't be as intense as a laser. This image to explain the difference between the normal light and laser light. The normal light have multiple wavelengths, while the laser light have the same wavelengths. The normal light may be divergent, not parallel to each other as the laser light. The normal light has multiple directions, while the laser light unidirectional. Laser delivery system: articulated arc, glass fiber optic cap, hollow wave guide or tube. Laser tissue interaction: the laser light can have 4 different interactions with the target tissue, depending on the optical properties of that tissue: a reflection, absorption, transmission, scattering. Reflection: this property of the laser causes the laser light to redirect itself off the surface, having no effect on the target tissue. This reflected light could be dangerous when redirected to an unintended target such as eyes. For example, the course-detecting laser device uses this property to measure the degree of the sound tooth structure. Absorption. The amount absorbed energy depends on the tissue characteristics. The primary components are termed chromophores, which can absorb the laser light of a specific wavelength. The primary determinant which decides the absorption of the laser light in the target tissue is the wavelength of the laser used. This property explains the photothermal effect of the laser light. Transmission. The transmission of the laser energy directly through the tissue without producing any effect on the target tissue, which is the inverse of absorption. This property depends on the wavelength of the laser used, which explains the laser tissue selectively. Scattering. Weakening the intended energy. No useful biologic effect. Heat transfer to the adjacent tissue, which produces unwanted damage. However, a beam deflected in a different direction facilitates the curing if the composite resin. This image explains the difference between the four tissue interaction with the laser light, which is absorption, reflection, transmission, scattering. The laser emission modes: continuous mode, gated pulse mode, free running pulsed mode. The continuous mode, in which the laser energy is emitted continuously, uninterrupted beam, relatively constant power. While the gated pulse mode is periodic alteration of the laser energy being on or off, similar to blinking of an eye. A mode achieved by opening or closing of the shutter in front of the beam path, have high energy or shorter duration pulses. Free running pulsed mode, high energy of the laser light are emitted for short time, microsecond, followed by a relatively long time when the laser is off. This is computer controlled. Image to explain the difference between the continuous mode and pulsed mode. The continuous have the same energy or not interrupted, while the pulse have high energy and interrupted. Another image to explain the difference between the continuous and the gated pulse mode. Exposure time. It is the amount of the time the operator keeps that the laser light directed at tissue. It varies according to the delivery system, either continuous wave or pulsed. The rate of the pulsing is measured in pulse per second. The pulse width, it is defined as the time required for the pulse to rise from zero intensity to maximum intensity and return to zero again. While the tissue relaxation time, it is the time allowed for energy to be absorbed by the target tissue. Advantage of the laser surgery: hemostatic effect by sealing blood vessels, accuracy, rapid healing, reduces inflammation, little post-operative scarring, low level of discomfort, reduces post-operative edema, sterilization of the treatment site, no infection, minimal damage to the surrounding tissue, reduction in the post-operative pain sensation since the nerve endings are blocked, dressing and suturing is not required for the wound closure, breathing time is reduced. Disadvantage of the laser surgery: technical difficulties, lack of the precision in the depth of the cut, tissue not available for the histopathology, Hazardous. Dispersal of the viable virus particles in the flame. Laser treatment is very expensive. Protective measure. Safety goggle should be worn by the patient and operator. Never use the laser in the presence of flammable anesthesia. Never look directly into the laser beam. Never point the laser handpiece at any person except at the treated area. Never step on or arbitrarily bend the fiber optic cable. Never move the laser machine during the operation. Thank you.